Welcome. Hi, everyone. My name is Duran, and welcome to GPH Alumni Board Panel. And we are all excited to meet you and to share our experiences and to engage in this discussion. And to kick us off, what I'll do is I'll introduce myself, and then I'll allow each of the panelists to introduce themselves as well. So again, hi, everyone. My name is Duran. I am an alum. I graduated in 2014. From the program, and I currently work at CVS Health as part of the Health Services Strategy and Innovation team. I'm a manager on the team, and a little bit about the work that I do and what that entails, and we'll go more into this when we get into the actual discussion, but just a brief overview. So what my team does at CVS, and for those that don't know much about CVS, CVS is the largest healthcare company in the country. And what my team does is it focuses on growth opportunities for retail pharmacy. And when you think about that, that's not just pharmacies specifically, that is also items tied to primary care, tied to digital health, tied to omni-channel, digital transformation, and real estate. So there's a whole bucket of items that fall into that. But again, I can share more about that, but it's nice to meet all of you and welcome, and I'll be moderating today's event. From here, I'll go ahead and let the other panelists introduce themselves. I'll go ahead and volunteer a name. How about Samara? How about you go ahead and introduce yourself?
Sounds good. Thank you, Duran, and thank you everyone for joining. So as Duran mentioned, my name is Samara Bogwa, and I also graduated in 2014 with an MPH in Community and International Health. So excited to be here with my classmate. I currently work for Capgemini Invent. We are a consulting firm, and we work closely with pharmaceutical companies, med tech companies, as well as other life science companies. And what I do as a senior consultant involves a lot of different things. We have the opportunity to work with senior leaders within these organizations to help them anywhere related to strategy, to change management, to drug launches. On Friday, I just finished up work related to a drug launch. And on Monday, today, I'm now working on a corporate social responsibility project where I actually have the great opportunity to define what the parameters are for how this organization will give their funding and partner with local organizations in a philanthropic sense. So it's a lot of diversity in work, but I'm excited to explore a little bit more about my work and my past experience through this panel.
Thanks, Samara. How about Victoria? How about you go ahead and go next?
Duran, I'm Victoria Good. I graduated in 2018 with a concentration of public health nutrition. I am the special assistant to the director at WorkWell NYC within the Office of Labor Relations at the City of New York. So it's a big, long way of saying I work for city government for New York City. So WorkWell NYC works towards creating a healthy environment for city employees. As you know, over the past 2 years, they've been under an incredible amount of stress and have helped to keep the city running. So we're kind of there as a way to keep their morale up and offer them opportunities to focus on their mental health, their physical health, and generally their holistic well-being. So we offer different programs like discounts to gyms and fitness classes and all sorts of things to help keep them up and running and keep the city running as well. So my job is a little bit more on the administrative side. I work with our vendor contracts as well as developing programming for the employees that we have.
Thanks, Victoria. I'm just going by the order of faces that I see on my screen, and the next person I see on my screen is Manpreet. So if you don't mind, you can introduce yourself.
Yeah, thanks, Duran. Hey everyone, my name is Manpreet Sachdev, and I'm really excited to join you all today. So I graduated from NYU College of Global Public Health with my MPH in 2019. And since then, I've been in the public health space at different points of program development and strategy. And so in my current role, I am the manager for people analytics and strategy at the Center for Employment Opportunities, which is a national nonprofit that focuses on supporting those who are coming home from incarceration. So a very, very specific subset of the population. And I would say a big chunk of my role is really to brainstorm ways that we can leverage data specifically data related to our people, to make progress against our strategic plan. And so regularly working with our executive team for more like org level strategic projects. But what I would say is like most compelling about my roles and my background is that I've been really able to develop skills in using data to drive change, and also leveraging a lot of storytelling to be able to communicate to different levels of leadership, whether it's to get buy-in on a project or it's just to give an update on a project. So I'm excited to share more about my experience and of course learn about the really diverse, awesome experience of everyone in the panel today.
Thank you. And last but not least, Corey.
Hi, everyone. My name's Corey Hammond. I graduated with my MPH in 2017. And since then, I've been working for Partnership to End Addiction, which is a research and advocacy nonprofit organization here in the city. In the Partnership org, I belong to a small research team called the Science and Technology of Early Prevention team. And so in that research team, we focus mainly on prevention of substance use in pregnant and postpartum populations. And so within that research right now, I'm project coordinator for one specific NIDA study, NIDA-funded study, where we are developing and testing an anonymous screening and brief intervention program for women either at high risk for substance use or currently using substances while they are pregnant or postpartum. And we're working with home visiting programs in New Jersey to help test out this intervention. So yeah, I'm excited to talk more about research and nonprofit work and all sorts of different aspects of my job. Thanks, everyone.
All right. Thank you so much, panelists. And as you all have heard, we all have given you a brief introduction into who we are. But with that being said, we'll go ahead and kick off the discussion now. And just a quick overview. So what we'll do here is we'll be answering a series of questions regarding our backgrounds, our experiences, and just some helpful tips that we can offer all of you. But there is a chat function here within Zoom. So please feel free to drop questions as we are going through. And then when we are finished with the actual discussion portion, we will begin the Q&A and we'll have an opportunity to address all of your questions. So with that being said, we'll go ahead and kick off the discussion with our first question. And each panelist will have an opportunity to answer and provide feedback and their thoughts on these questions. So, we got some exciting stuff coming for you guys. So our first question is, what prior experience do you have working in public health? And I'll go ahead and begin with, answering that question. So my career began working, I completed a fellowship in public health at the University of North Carolina at Chapel Hill. Really, really awesome experience, awesome opportunity, really gave me an opportunity to work with a number of high level and extremely successful individuals within the field of public health. But from there, I pivoted into pharmaceuticals and worked for a pharmaceutical company where I was conducting clinical research. So what we were doing essentially is we were conducting global clinical trials focused on developing a drug for multi-drug resistant tuberculosis. These trials spanned across 5 continents. We had over 20 countries, clinical sites within 20 countries participating within these trials. It was quite revolutionary, actually. And it gave me a lot of great exposure to the world of pharmaceuticals, global health, epidemiology on a global scale. But I wanted to focus more on healthcare management and policy. That brought me to NYU, where I received my MPH. And from there, I began work with the New York City Department of Health, and then going on to the New York Health and Hospital, or as it was called at the time when I joined, New York City Health and Hospitals Corporation. And in both cases, I was focusing on work that was driving forward initiatives that were tailored to transforming primary care, transforming care management, incorporating or integrating behavioral health into primary care services. So in a nutshell, transforming healthcare, to make it more efficient, to make it higher quality, to make it more accessible. And for those that don't know much about the DOH, Department of Health, or the New York City H&H, or Health and Hospitals Corporation, the DOH is one of the largest public health agencies in the world, and doing amazing work within the city of New York. And then H&H is actually the largest public hospital system in the country. So they actually have the largest concentration of public hospitals throughout New York City and in the country as a whole. If you don't know who they are, you may have heard of one of their hospitals that's part of that network called Bellevue. Very popular hospital. It comes up a lot in the media. But anyways, the point is that I had an opportunity to do some amazing work with that organization, and then also worked with another organization known as the Mental Health Service Corps, as well as Montefiore Health System, doing similar work around practice, primary care and behavioral health integration. And then that now brings me to CVS, and I'll tell you guys more about that when we get further along in our discussion. But that covers a little bit more about my background and prior work in public health. And so I'll let the panelists speak towards their prior experience as well.
All right, so I'll go next. So this is also really awesome for me to learn more about my colleagues. So thank you for coming up with these questions and giving us an opportunity to share, Duran. So my experience in public health is quite diverse. I like to describe my interest as I'm really interested in project management. And there isn't a particular disease state that I would say was my niche, but because of it, project management and wanting to see different programs start from inception to, actually like delivering on their goals and then ultimately impacting populations, like that's the part that I like to see, something from beginning to end, and project management allows me to do so. So once I left NYU, and actually maybe I'll start a little bit while I was at NYU, but I had the opportunity to intern at the UN, and I've always had an interest in global health. So I was in the office of the special advisor on Africa, and through that experience, I was labeled the health expert. I didn't quite feel as the health expert, but it gave me a really great exposure to how that particular office was talking about and also advocating for health throughout the continent of Africa. And then after that, I did a fellowship, like Duran mentioned, I did a fellowship soon after graduation, and that was related to emergency management. I relocated to DC and I worked at the FDA, and I worked with the training team to ensure that all of the partner agencies were prepared and actually knew the protocol for addressing mass casualty incidents and other major catastrophic events, unfortunately. But through that preparedness, helped to ensure a safer America, as we like to say then. And then where I have been in the last couple of years, so I worked for a company called Becton Dickinson, a medical device and technology company. And I had a few roles within that organization. The first being a consultant, working with different hospital clinicians, primarily infection preventionists, nurses, as well as pharmacists. And then we had a software that enabled us to streamline, map, and make your data look pretty, so that these clinicians could run different analytics on that data. So I had the opportunity to partner with those clinicians and help them identify those patients that were of most importance to them. If there was a disease outbreak within the hospital, I would help them report that to the CDC, as well as work on a risk mitigation strategy with those clinicians. I was in that role for about 3 years, and then afterwards I transitioned back to, I would say, what my passion is, global health. And I was working with the global health team within BD. And it was a really cool role because we found ways in which our people, products, and resources could have an impact on health around the world. And it wasn't just saying, hey, we have these safety needles and we're just going to bring them to a region that does not have safety needles. No, I feel like we went above and beyond to ensure that our clientele or the populations that we were serving had sustainable programs. So we would go in there and start from a risk assessment to then going in country and partnering and really being partners, because I feel like sometimes in international health that doesn't always happen, but finding ways for us to really drive our partnership and ultimately influence the health of larger populations. And we would do this on a rotating cycle of doing those assessments every 3 to 4 months, and finding ways to refine our program throughout. So really neat experience. I got to do some travel. I know as public health folks, many of us do like the travel. So I went to Kenya, Ethiopia. I did some travel in Europe through the organization. A really neat experience. And then now that has led me to consulting. When I was thinking about next steps for myself, I was like, what do I really like? So, the project management part, and I realized I do like the client-based work and then the international work as well. So I'm getting all three of those within this role, and I will talk about that in a bit. I took up too much time, but that's a little bit about my background.
I can jump in and we'll just follow the train. So my prior experience with public health was, seems a little bit less robust than Duran and Tamara's. I know that they have so much varied experience. It's so cool. I did not do any fellowships, but what got my experience in public health started was actually when I graduated from undergrad. I wasn't quite sure what I wanted to do, and I had been, like many other people, pre-med. So I didn't know what to do. And so I started applying to med school and PA school, but you needed healthcare experience for that. So in order to get my 5,000 patient hours, I decided to get my certification in EMT, and I became a volunteer EMT in a rural area in Southwest Virginia, which is kind of known as Appalachia. So for a lot of people, if you've heard about the opioid crisis, the area that I was in was one of the hotspots for the opioid crisis. So my experience in public health started with running EMT and being a volunteer EMT in that area. So I saw the disparities of healthcare being provided to that area. I also saw the gaps in healthcare. And basically, I knew that I didn't want to go to PA or med school or anything like that. I decided I wanted to be on the back end. And not be part of the reactionary care system. I wanted to be part of the proactive care system. And that's what led me to public health. So I applied to public health school, and that's kind of actually what got me into my job now. I did an internship with Workwell NYC, and then I decided I liked it, so I stuck around. So that's kind of my short and sweet, and I'll talk about the work that I do in a little bit, but I will pass it on to Manpreet.
Thanks so much, Victoria. So I would say, similar to what Victoria mentioned, my journey with public health has definitely not been linear. So I started my undergrad actually at NYU as well, with really no inclination of even wanting to pursue public health in specific. I just knew I wanted to be in a space where I could see the impact of my work pretty quickly, kind of like that instant gratification that we all are super obsessed with. And so in my head, similar to Victoria, the most logical and straightforward way to do that was through clinical medicine. And so I, started undergrad at NYU in 2013, and I studied psychology and molecular genetics, which gave me a little bit of that clinical exposure from my professors. And then I also spent some time volunteering as an EMT, similar to Victoria, worked in the back of an ambulance around New York to really get that hands-on experience. And though the work for me was super fulfilling and extremely rewarding, I still felt like I wanted to do more and have a larger scale impact. And actually, that's when I was referred to this internship at Health Leads, where I eventually found my way into the public health space. So Health Leads is a national healthcare organization where I had the opportunity to work directly with patients and manage different social determinants of health programs in New York City, actually starting at Bellevue Hospital that Duran mentioned. And so my focus there was to really strengthen the continuity of care and partner with primary care providers to use SDOH in their work with supporting patients' health. So anything from food insecurity to transportation to access to Medicaid benefits. And so from there, I actually joined on to Health Leads as a full-time staff member after I graduated. And in that management role, I experienced kind of all aspects of program development, from, I would say, design and strategy to pilots and implementation, all really to ensure that we had a high program utilization rate. And so seeing the difference that we can make by connecting families and patience to immediate resources was super impactful for me. And I knew I wanted to be in a space where I could make that individual, but also community level impact. And so from there, it was really about honing in on the skills that I knew I needed in the space. I went back to school to NYU for an MPH and continued to explore, different public health spaces. And through my experience, through all the courses I took, what I knew for sure was I wanted to be able to use data to drive change. And that was at the core of what I really, heavily enjoyed. Relying on both the qualitative and quantitative numbers to support where impact can be made individually at the community level, but also at the national level. And so I think that's probably why I've ended up staying at national organizations for most of my career. So from there, during my time at NYU, that's where I was really exposed to a lot of different avenues of public health outside of the traditional clinical hospital setting that I was most familiar with. And so I know we have a couple more questions where I can share more about that too. But my internship experience during undergrad was definitely a very big kind of opener for me to enter the public health space. And I'll pass it to Corey to finish us off.
Great, thanks so much. I think my past experience is definitely not as varied and illustrious as others, but I have an undergraduate degree in public health. I went to Tulane for that, and then wasn't really sure what I wanted to do next. And I knew that getting an MPH was probably going to be in my future anyway. So I just went straight from undergrad into grad school. And then while in grad school, again, I did not know what avenue of public health I really wanted to pursue. So I got a lot of different internships, which I'm sure at one point we'll talk about unpaid internships and whether or not that's something that you should do or not. I have some strong feelings about that. But so my first one, I was working at Bellevue, keeps coming up. I was working with a group of toxicologists on a substance use prevention program that we brought into high schools. So that's kind of where I dipped my toes in when it comes to drug policy and substance use and harm reduction and things like that. And then I worked at the Fortune Society, which was an incredible organization that provides kind of wraparound services for people coming out of Rikers. I worked on an HIV and Hep C prevention grant there, which really got me interested in incarceration health and the social determinants of health and again, substance use. You can't talk about incarceration without talking about substance use and drug policy. And then finally, I worked at HealthRight International, which partners with NYU. That was my last internship. Had a great time there doing global health, a lot of development work and fundraising, and then just went straight into my current job at Partnership to End Addiction. And then I've been there for the past 5 years. So that's kind of my journey so far.
Great. Thank you all for sharing your thoughts and, for answering that question. And I think you guys each touched on a little bit on this next question as well, too. And so this next question is, how did you find your passion or your path in public health? Again, I think each of us have kind of touched on it a little bit, but I'll go ahead and just share a little bit about myself. And I'll make it brief too, because I'm being mindful of time. I went, for undergrad, I went to the University of Michigan, Ann Arbor. And at undergrad, my intention was to become a doctor. So I had every goal of, going to med school and all of that. But, as part of that process, there's certain kinds of experiences that you have to accrue, be that hours, within a clinic and or hospital, be that, research. And so I had an opportunity to really gain exposure to public health by, initially taking steps towards med school and then realizing, oh, wait a minute, I actually love this work in public health. This is amazing. And really also being able to determine and better clearly distinguish the difference between a career in medicine versus a career in public health. And from there, you could just say it carried me forth. And everything that I have taken on thus far since then has been public health or oriented around public health in some way or another. So again, you've heard each of the panelists touch on this point, but the opportunity to drive impact, across populations is something I'm hugely passionate about. Health equity is something I'm also hugely passionate about, and that is at the core of public health. That is like one of the pillars of public health, right? And then in addition to that, what I learned very early, and which you're also seeing through all of us on this panel, is that there's a wide array and a diversity of trajectories you can go in terms of your career in public health. There are the traditional routes, but then there are the non-traditional routes. And my career consists of both traditional and non-traditional. And so once I saw that, I realized like the world is my oyster and I can still, accomplish so much and pursue this passion. And so again, it started early and it continued on throughout my career, and eventually, coming to NYU, receiving my MPH, and now bringing me here to CVS. But it's been evident, from the beginning. So those are my thoughts on my passion and my path. But looking forward to hearing about my panelists, my fellow panelists, and their thoughts as well too. And by the way, if you guys, we don't have to keep following the same order. If you guys want to switch up the order, that's totally fine. So maybe we can start with Corey. We can start with you this time.
Sure. Yeah, I feel like I have a pretty short answer to this too. I feel like everyone wants to be a doctor until they discover public health, at least on this panel. I was also pre-med in undergrad, but then I took my first public health class and I was like, wait, this is how I'm going to make much more of a difference. And I mean, just fell in love with the field almost immediately. But like really finding my passion, similar to kind of what Victoria touched on, growing up, I'm from North Carolina, and my hometown was really severely impacted by the opioid epidemic, and substance use is rampant in my hometown, and it, really kind of changed the way that I grew up. And so that's always been something that I knew I was drawn to. And I think when it comes to my career in public health, I've been much more drawn to like subject matter areas as opposed to like position types. Like I hear Samara talking about how she loves project management. And for me, I just love working in substance use and drug policy and things like that. So I'm much more drawn to the subject matter instead of what I'm doing. And so I just knew that when I finished my internships and was graduating, that I wanted to work in mental health or substance use in some way. And that is the kind of research that I am most passionate about and would like to continue for as long as I can. I feel very strongly about advocating for the rights of those who use substances. And I'm grateful that I get the opportunity to work with as much of a stigmatized but important population as women who are using substances while they're pregnant. It feels very important. And yeah, Victoria or anyone else who wants to go next?
Yeah, I can add on to what I was saying earlier. I think my passion for public health, like Corey was saying, kind of came from seeing the disparity of care that people received, whether they were affected by substance use or addiction, or just generally living in an area that was heavily affected by people living below the poverty line and receiving different types of care based on the health insurance that they had, and having a private hospital 15 minutes away and the public hospital 45 minutes away, and being the person to transport these people. And a lot of times we were just talking to these patients for 45 minutes as we drove them to the public hospital, knowing that every minute in the truck was another minute that they weren't receiving care, and that could eventually affect the outcome of their health. So that was kind of what drove the passion towards, and like Duran was saying, away from the traditional path of wanting to be a doctor or a PA or a nurse, and into wanting to affect the population and create more impact. I think the other part to public health for me was that there's so many different paths that you can take, and you can kind of pivot at any moment. So a little bit different to Corey, I'm not so driven by the subject matter, but by the work that I can do. So a little bit closer to Samara is that actually, I kind of describe myself as a little bit of a magpie or a jack of all trades. When it comes to work, I like doing a little bit of everything. So when people were telling me in public health, you'll get to wear many hats, you'll have to wear many hats, I was like, give me hats. So that was kind of actually a little bit of a draw. I know that's not for everybody, but for me, I thought that was great. It meant that I would never get bored. I would never lose my passion because I would always find something different, something new. And it would continue to make an impact. So that was, what really led me here. I'll pass it to Moncrief.
Thanks, Victoria. Yeah, I can kind of share a little bit more how I, got into the mass incarceration space. So back when I was working at Health Leads, I had started my graduate career at NYU and pursued a concentration in program and healthcare management. And so what I actually really appreciated about my time in grad school was the exposure I had to so many different specialties within public health. I think we've all heard from, this, group of 5 people, which I'm sure it's even more experiences across all the audience members, but there's really so many things you can do in public health. And for me, it was really cool to see that, each professor I worked with or each professor that I learned from was in such a different sphere, anywhere from mental health to, New York City government or consulting, the list goes on. And so I personally was really only aware of the social determinants of health work and health equity work that I had done at Health Leads, both, when I was working there as an intern and after I'd graduated as well. And I remember I had this one particular professor that explained, how the very same social, financial, and health inequities that I focused on in hospitals with patients also existed in, a ton of other overlooked communities. And that's actually where we started spending a couple of classes on discussing mass incarceration as a public health issue and the subsequent, inequities that population faces as returning citizens. And so I would say that introduction to mass incarceration and the history is really what opened my eyes and also got me interested into avenues of public health that, frankly, I didn't even know existed. And so from there, I knew for me, the next step was really combining my passion for using data to really understand opportunities so that I can make more community and national level impact, given that was something that I really missed in my time during my internships. And I would say that, for public health professionals, I'm sure one of our kind of grounding factors is we really want to make a difference in our community. We want to make an impact. And so for me, I knew that one of the gaps that I noticed in, organizations I worked with or, that I've just heard of was they really didn't use data to show why they were doing what they were doing. And so for me, that felt like such a prime opportunity for us to make sure that, when we're presenting program outcomes or when we're presenting, project initiatives to, local governments, whether it's, to launch a program, whether it's to get funding, whether it's to get an investor on board for a private company, data is that shared language that really helps people see why you're trying to do what you want to do. And so getting that introduction to mass incarceration during school, as well as, of course, all the analytical courses that we all had to take is really where I was able to combine a couple of my different interests. So yeah, it's been a really cool journey just to see how a lot of the same principles that I noticed in community hospitals and in more clinical settings also are very prevalent in, other underserved communities as well.
All right, and I'll close this out here. But for me, it was something similar to what Corey mentioned, just where I grew up or how I grew up. So global health has always been an interest to me. My parents hail from Kenya and Zimbabwe. So growing up in a very cultural household definitely contributed to why how I became interested in public health. So I traveled to Kenya a lot growing up, and I remember just seeing these light blue trucks and just being fascinated by them and wanting to understand what they were doing, but they seemed important and they seemed like they were helping people. And I've always been driven by helping people. So as I got older and being exposed to the healthcare field through the work that my family was doing, as well as other relatives, I knew I wanted to continue down the path of healthcare. And I knew I had that global interest. So when I learned about public health, I would say it was in high school. I knew that was something I wanted to pursue. So in college, I had an unofficial public health minor and got the opportunity to take classes within the Graduate School of Public Health. So that really reinforced that this is something I wanted to do. And yeah, so that's how I ended up here. I know we have a few other questions to go through, so I'll pause there.
Thanks, everyone. Really appreciate your feedback and your thoughts on that. So our next question is, what did you do at work today or last week? And so, for all of the attendees here, think of this question as like a spin on, what is a typical day like in the life of Victoria and the life of Samara, like in the life of Duran, like so that you guys can get a better sense of what it looks like at our respective companies or within our respective teams. Again, I'll keep it brief and I'll start first just because I'm being mindful of time. So again, I mentioned before, I work at CVS. I'm part of the Health Services Strategy and Innovation team. What we do is we work very closely with the senior executives within the company. And by senior executives, pretty much everyone up to almost the CEO. And so the CEO or the EVP, Executive Vice President, or the Senior Vice President will come to us and say, hey, we have a potential opportunity for the entire company. We want you to explore whether or not this is viable. We want you to develop a strategy in terms of how to analyze this and determine whether or not the company should pursue it. Analyze that, come back to us, give us some recommendations, and green light it or red light it based off of what you've determined. And also, in addition to that, we work very, very closely with like all of the core businesses within the company. So let me put this in perspective. Like if you guys have probably seen, if you keep up with news regarding CVS, you've probably seen a number of developments within the news over the past couple of months. So for example, CVS recently announced that it's closing several of its retail pharmacies, that it would be focusing more on digital transformation. My team is responsible for that decision, right? About a year and a half ago, CVS made headlines when it was basically saying it was ensuring that there were equitable distribution of COVID vaccines to communities, African-American and Latino communities. That was, again, my team. We were responsible for that. Or if you go into a Target and you see a CVS inside of a Target, right? We work a lot with real estate, right? These are all functions of the different core businesses within the entire company. And the last part of this is that we also ideate net new ideas. So there may be a completely new space right now that CVS is currently not working in at all, right? And they're like, we want to go into that. We want to explore that. We want to build a market for it. My team and I, we are responsible for exploring that and determining whether or not that's viable. So hopefully that gives you a little bit more clarity in terms of some of the work that we do and what I do, and happy to share more, but I'll go ahead and hand it off to our next panelist. And I guess up next, I'll go with Manpreet. You can share your thoughts on this.
Thanks, Duran. Such a difficult question because I feel like I end every day thinking I did a lot, but also nothing at all. So as I'm sure you gleaned from my responses, heavily on the qualitative and quantitative data in my role. And so really making sure that we, whatever our strategic vision is, whether it's for our team, our department, or just the org in general, we want to make sure we have some really strong metrics tied behind it. And so what I actually worked on today, and one of my major priorities for this quarter, is putting together our very first data dashboard. And what that looks like is working with different senior leadership on our team and also our executive team to understand, how can we better identify metrics that show progress against our goals? And then part two of that is how can we translate that into a visual dashboard that can be shared with our executive team and senior leadership on, a regular basis. And so I would say, aside from, the very numbers-driven analytical piece that, of course, comes with building a dashboard, it's also thinking about how do you make, a huge set of data that's probably, not the cleanest, probably super complicated. How do you make it digestible for different levels and different audiences? And so a bulk of my kind of work and priorities, during this next couple of weeks is really making sure that I understand who my audience is for these different dashboards, so that they're able to get, at the, a glance of, 30 seconds, they're able to get those top line metrics to understand as a department or as an organization, are we, successfully meeting our goals, or is there somewhere where we might want to revisit and like realign on what our priorities are? And so putting together that data dashboard has definitely been a big chunk of my role. And it's continuing to be a really cool space to get to work with different levels of leadership.
I can go next. My day, so I'm in the last couple of months of implementation of this one research study that I'm working on. So today I had a couple meetings with some of my home visitors who are participants in our research, just checking in, asking about clients if they can refer to the study, things like that. Then I had to facilitate a qualitative interview that we're using as data with one of our home visiting participants. And so I did like an hour-long interview with her, asking about how her job has changed during COVID, asking about what it was like to be in the research study, things that I could have done better in the last 2 years. A one-on-one interview, which is one of my favorite parts of my job currently. And then finally, I had a meeting with one of our co-investigators. We're trying to figure out whether our product, which is this kind of app-based screening and brief intervention tool, whether we can roll it out as like a functioning tool right now outside of the confines of research, which feels a little scary because I've been working on this for so long, and it a strange idea to have it like finally be out in the world for people to use. But so yeah, a lot of meetings today, but my whole job is just trying to get this study to the finish line at the end of July, and report back to NIDA with hopefully positive results.
I'll go ahead and volunteer. I was about to say Samara. Yeah.
Okay, thank you. Yes, so my Friday looked very different than today. So Friday, I was wrapping up a project and just sending a lot of emails, just making sure that once our team leaves, and that those folks who remain on the project know what their roles and responsibilities are, and anything that is outside of our scope has a path forward. So we were just working with a lot of the different vendors that we were partnering with for this drug launch. So that was Friday, doing our last bits of pieces for our testing plan. But then today, I now had to pivot how I'm thinking and switch to corporate social responsibility. So I've been deep in some background research. Also, I'm trying to understand what the company that we're partnering with for this new project has in terms of their CSR strategy. And as I previously mentioned, there is none. So what are other pharmaceutical companies doing, and trying to craft some questions for a client meeting that we have later this week. And then trying to schedule interviews with various stakeholders. I saw the CEO's name on the list. I wasn't quite ready for that, but I'm up for the task. But I mentioned that because I value the diversity of experience I've had in public health, because I could have that conversation with the CEO, and then I could have a conversation with someone who doesn't have that executive visibility. But I'm thankful to GPH for giving me that comfortability through the various courses that I took. So kudos to this great program. But tomorrow it's gonna look quite different too. I think I'm going to move away from the background research and then just jump into doing and planning the presentation for Wednesday and so on. So it's very, very, very different, but I'm excited to start something new and challenge my brain to think about this new space I'm in.
I can close this out with this question quickly. So as I mentioned earlier, a lot of my work is a little bit more administrative and wearing many hats. So some days, I won't mention last week because I was out on vacation last week, so it doesn't count. But today was a lot of administrative work. So whether that be making sure that the vendors that we work with who provide fitness classes or education pieces, making sure that they get paid, making sure the lights stay on, in a way. So working with those interpersonal relationships, whether that be in the agency itself, working with the different teams within the agency, to making sure that all of those pieces happen, and also working with my director to make sure that we're gearing up for a round of contract extensions with our vendors. So working within the different agencies across the city to make sure that our contracts continue. Again, just kind of working to make sure that the light stays on in the work that we're doing, which I enjoy. But one of the other pieces of the work that I get to do, it has to do with some of the work that I was taught at NYU, is the systems approach to the work that we're doing. So as I mentioned, I like being a magpie at different tasks. And so I use that systems approach that I was taught at NYU to kind of operationalize work well in the work that we do. So I really enjoy creating processes and systems to make our work a little bit more efficient. So tomorrow I get to get back into that a little bit more, get out of the admin side, and get back into operationalizing our work a little bit. So I get to work with all the different teams, and I really love that.
Thanks, everyone. We have time for maybe about 2 more questions before we begin the Q&A portion. So I'll go ahead and ask the next question, and that is, when you think about, when each of us, all of us here on this panel, think about our younger selves or our less seasoned selves in our careers, our respective careers, what advice, would you give yourself if you're looking at that person? What advice would you give your younger self as you were exploring career goals in public health? Like, so now that you've accumulated the experience that you have, you've now graduated from NYU, the program, you've learned so much, and you look back and you say, man, if I had only known this, or if, what would that piece of information or wisdom, what would that be that you would share with your younger self as you were exploring your goals in public health? And I will not start by answering this question. In fact, I'll just volunteer myself as a last. So you guys all know I'm going last now. So first person up, I'm going to volunteer you though. And I'm going to go with Corey. Corey, how about you share your thoughts on this?
Sure. Things that I would wish that I knew when I was starting out. Maybe keep my biostats notes. Wish I remembered all of the things that I once knew how to do in SPSS. But aside from that, I think an important one that maybe often doesn't get talked about enough in public health is this idea that, like, especially when graduating with an MPH, your expertise is worth something. And so obviously we're in this work because we want to help people, and being super successful and making a ton of money is not like the driving factor that brings people into public health. But at the same time, like, even for grant funded positions, don't sell yourself short. Your expertise is worth money. And so you're allowed to advocate for yourself and for your skill set, and know what you're worth when it comes to salary negotiations and things like that. Those are things that I would have told myself, wish I knew. Yeah.
Thanks, Corey. I can go really quickly after. So plus on everything Corey said, I think super helpful advice just in general, like career advice, not specific to public health, but for everyone. I would say for me, I would totally tell myself to be open to non-traditional routes, because I think I was very dead set on like clinical as being the only way to make an impact. And so I think I held myself back from exploring other opportunities earlier on. And so if you're kind of in that space, you're like not sure if public health is right for you, or you're not sure what in public health you want to do, I think everything that you think public health is, it's like 10 times more than that. And so be open to exploring, things you might not be familiar with or non-traditional routes by just talking to people. I will say, like, I'll volunteer this group. I'm sure any of us would be happy to connect with folks like offline on LinkedIn or afterwards, just to talk more. But as much as I hated networking when I was younger, and I still kind of do, it's super, super important, because that's the only way you'll get to know if there's fields that you absolutely love, or there's fields that you're like, yep, I hate that, I would never do that. So as much as you can, don't think about networking as like you only do it to get a job or you only do it to get a referral. Networking is really just talking to people and building a relationship so you can see, is this person doing something I could see myself doing 5 years from now? And so that mindset shift for me was super helpful and made networking less scary. because I realized how important it was, especially for public health.
Manpreet, I think you got, oh, Victoria, you can go ahead.
No, go Samara.
Okay, thank you. I was gonna say, Manpreet, you touched on probably all the things I was gonna say, so this might be short, but yeah, just don't. It's okay to not have it all figured out. I will say, when I was graduating from the program, what I envisioned for myself was living and working in a rural village somewhere in Africa, and doing some of that project management work that I talked about earlier. And someone on LinkedIn was like, hey, we have this role. And then all of a sudden they handed me an iPad and said, wear a suit. And I was like, well, this is not what I envisioned for myself for within the field of public health, but I'm going to keep an open mind, and this might be something interesting. And, 6 years later, I'm like, I'm still very much interested in it and continuing with it. So just know you don't have to have it all figured out, and maybe that vision that you have for yourself is subject to change, and that is okay. What else would I tell my younger self? I would say, going back to what Manpreet said about networking, there are people that are willing to answer questions, and there are people whose career paths just look interesting, and you just want to, see where the world takes them next. And I think LinkedIn is a great resource for hearing from and sharing with different people. So I highly recommend each one of you on this call to reach out to each one of us. And it doesn't have to be in the form of a message. Just connect with us on LinkedIn so that we can all stay in tune with whatever opportunities we respectively have. So I think those would be the two main pieces of advice I would share with all.
It seems like we're just building on each other. So I'll echo everything that everyone has said so far, and also add ask. The worst they can say is no. And that's something I'm still learning, and I still struggle with too. But really, you give yourself that pep talk. The worst they can say is no, or maybe they don't respond, but it doesn't mean that they don't care, or maybe that it's a no forever. Maybe it's a no for now. So, just ask. And especially in the world of public health, it's very small. Chances are, if they're saying no, it's not out of any sort of malice. It's just they don't have time, or maybe it's not right now. So keep that in mind, and you can always come back and revisit it at a later date. And I would also say, advice to my younger self, if there are anybody still in school, stay in biostats, stay in FE, take an extra course, take an extra biostats course, take an extra FE course. I know it's tough if you're not minded that way, which I was not. And there are plenty of people who are minded that way and really love it, and I applaud you. But I wish I had taken an extra FE course or an extra biostats course, because I think it could really help my lens right now. So stick with it; it's worth it.
And yeah, my thoughts. So I think, Corey, I think that was you that hit on a really great point around knowing your value and knowing your worth. It's very easy to think, at least for me, really early in my career, I was like, oh my gosh, what is the value of this? I should have gone to med school. Maybe that's what I should have done instead, right? And instead of just following that passion that you have, following that path and just firmly believing in it. And I've learned that throughout my career now. I can see it very clearly that that has opened so many doors. For me, it's very clear that this is who I am, and this is, I enjoy the work, but that it's who I am at my core, right? So really knowing your worth and owning it, because people will see it. People will see it when you step into a room, and they'll recognize you in terms of your expertise, in terms of your credentials, but also in terms of, what it is that you're passionate about. Another point is, I've done a lot of work that has, overlap with business, right? And with an MPH, you don't traditionally think of it. I mean, you just heard a little bit from Samara a moment ago, also too, some of the work that she's doing, but you don't traditionally think of that public health lens in the world of business. But I think one thing that we've seen recently in light of this pandemic is that there have been all types of new doors that have opened in new ways in which, a career or an education in public health are being treated, and that is by both the general public, but also by, corporations and firms. So I say that to say that understand that which you are interested in learning more about and what you bring to the table in terms of your prior experience in public health. And again, that passion is being received in new ways now. And that's something that like I wouldn't have been able to foresee that, earlier in my career. There's no way, I don't think any of us saw this pandemic coming, right? I didn't see that coming. And then all of a sudden it hits, and then you're like, oh man, I feel so grateful that like I have all of this knowledge. And as you guys have now heard about biostats and epi, yep, I can apply biostats and epi when I'm hearing about the different bits of data that are being discussed. And so there's so much value and so much knowledge in which you gain both in this program itself, but also in this field that pays dividends as you go forward. And that's something that, I definitely would have encouraged my younger, less seasoned self to lean into a bit more. And one last point, and that is, don't be afraid to lean into opportunities that make you very, very uncomfortable. Like step outside of your comfort zone just completely whenever you have the opportunity to, and if you seek either those opportunities themselves and or seek individuals that will support you in pursuing those opportunities, because it will go a long way in terms of opening doors. Okay, great. That brings us to our last question. And that is, what final piece or pieces of advice, do you have for current students and alumni as they look to make a lasting impact within public health? And again, I'm going last, so you guys know where I stand. So feel free to volunteer, whoever wants to go first.
I'll go first. So I think for me, two final pieces of advice. One, take that extra epi or biostat class while you can. Don't wait till you have to pay for it after grad school is done. But also just remember your why. Remember why you got into it at the beginning. Sometimes when the going gets tough, it's hard to remember why you got into it or what pushed you to public health in the first place. And if you find yourself forgetting your why, find a community that you can connect to and spend some time within that community. I think that, just talking to people in a community that maybe you want to work with can spark your passion again. So don't forget to stay connected with your community and remember what got you into this in the first place.
I'll add to that. So some of my closest friends are from undergrad. So when I got to grad school, I'm like, okay, I'm doing this for my passion. I didn't really think, what was I going to get out of this from a friend standpoint, but I truly value having friends who are within the same field as me. Let me clarify, having best friends who are in the same field as me. We're able to lean on each other. We're transparent about our salaries, and that has helped us, get those numbers that we want. And we bounce ideas off each other all the time and encourage each other when it's tough. So I would say lean on each other. And, if you haven't found those people yet, don't worry, there's still time. Once you start working in the field, there's opportunities to still meet people who can share that advice and be your support system. So I would say that would be the key piece for you guys as you're finishing out your time at GPH.
Yeah, I would add on, at the end of the day, similar to Victoria mentioned, you really want to make sure that you remember why you're in the field that you're in. And I know that we all want to make an impact, but I think for my advice would be, don't feel like you need the weight of the world on your shoulders. I think in public health, sometimes we fall into this thinking that like we are doing work that impacts, so many underserved communities, and so we have to be the best and we have to do everything, and so that can feel like a lot. And so I would say, be open to collaboration and just be open to learning from others who know more than you do, because there's always going to be someone that has, that extra expertise, that extra experience, has done one more fellowship than you have, but you really want to make sure that you kind of ground yourself in everyone's here to make an impact. And so it's a partnership, not an individual journey. So that would definitely be my piece of advice.
All of this so far has been so good, but I think I can just add very quickly that I would say that good advice would be to cultivate your interests in everything, whether it's public health related or not. obviously we get into public health because we care about others and we want to help others. And you don't necessarily have to do that every single day in your job. At the end of the day, what you do for your job does not define who you are as a person. Just take care of yourselves and take your vacation time.
And does that leave me? Okay, that does leave me. Yeah, so you guys have all hit on some key points, really, really great points here. One thing I will say, like Samara and I, we were part of the same class, right? And one thing I will say is that you really don't, well, let me rewind. Let me rephrase this. Stay in touch with your classmates, right? Make a point of staying in touch with your classmates. You really never know where you're going to bump into them again down the road. It's very easy to be, have fun when you're in the program, and maybe a year after the program, you guys, oh, well, it's nice to see you. You might hang out a little bit, but then it's, life takes over, and it's really easy, to lose touch. Stay in touch with them, because the thing is that we are all individuals who are leaders within this field. And you will more than likely, almost certainly, bump into those faces again down the road, in some capacity or another. And you never know the way in which you'll need that, either their assistance, or you'll never know in the way in which they may open a door for you, or you never know in the way in which they may have developed that they're teaching you something, or vice versa, you're teaching them something. But there's so much to be taken, from the networks that you build within the school itself, within your class, within your program. So that's one piece of advice I would say, just keep in mind. And that's I'm making a point of not reiterating anything that has already been said. So I just wanted to find something new to be said here. But with that being said, we are here at the end of the panel discussion, and we are now entering into the Q&A portion. So for all attendees here, you can ask us any questions that you have. Feel free to drop your questions within the chat. The chat is completely open, or if it's easier and you would like to come off of mute, or I'm not sure if we can actually hear you, but if we can hear you, I think you can come off of mute and you can just speak and share your question directly with us. It would be great to connect with you. Again, there is no quote unquote, don't think of any question as being quote unquote silly. Like, there is no silly questions here. Please ask us anything that you want. And one last final plug for all of us that are on the panel. Please connect with us after this is over. I'm going to reiterate that again when this is done, just to make sure that you guys heard it. But please make a point of staying in touch with us. We would love to answer any questions that you have offline, in case you don't answer them here. But again, any questions that you have for us?
I have a question. How many EMTs are on the line? Because I was very pleasantly surprised to find out it wasn't just me, a former EMT. So Victoria, Manpreet, who else?
We have a question in the chat. And before I, respond or give us a chance to respond to that question, Samara, was there anything else that you wanted to say on that before we do it?
Oh, no. Let's go to the Q&A.
Okay. All right. So the question was, what are your thoughts? And this is for all panelists, so don't feel like we need to respond in any particular order. But what are your thoughts on mentorship or job shadowing for people interested in pursuing an MPH or career in public health?
Corey, I think you unmuted first.
I was just going to say, this is a kind of a shameless plug for those of us as a part of the Alumni Association. We're starting a mentorship program. So if you're interested in doing some type of mentorship, whether that be being a mentor yourself or mentoring others, you look out for, I think it was in the most recent alumni bulletin that went out to emails. We're starting a program for that, and we would love interested parties to please join, because I think it is so important, kind of what Manpreet was talking about. Just there's so many things out there in public health that you don't know about until you talk to somebody who's doing it, and so a mentorship program like the one we're starting, hopefully we can make some meaningful connections. And if I can find the link, I'll try to put a link in the chat for more info about the mentorship program.
Looks like we got a lot of positive feedback to that. So we got some people that are really interested in learning more about that, Corey. Before I look to I think Nicole, I think I saw you had a question, but before I ask you what your question was, did anyone else want to provide any thoughts on that question that was just posed?
I would say with job shadowing, that could be a little bit challenging, but I guess this is where internships come up. And I would say during grad school or even in undergrad, wherever you are in your phase, there are a lot of opportunities for internships. Unfortunately, many of them are unpaid, but they are huge stepping stones. I don't know how many of you are familiar with this, but the Wasserman Center does have a grant. At the time when I was in the program, it was a $1,000 grant. So if you did partake in an unpaid internship, you would have that $1,000 stipend. So if you are currently looking for an internship and can't necessarily do something unpaid, you should definitely look into that and apply to that. And I feel like that's a good way to support unpaid internships. And then in terms of mentorship, maybe for any of you who are on the line who are working full time or still in your programs, mentorship is invaluable. I've made it a point. I would say I didn't do such a good job of finding those mentors that necessarily were directly tied to my field, but I did have mentors who did support me in other ways. But I would say try your best to find folks who have those profiles that mirror some of the interests that you have and foster those relationships. At times, I think I held back because I didn't want to feel like I was asking for something of someone who was too important, but someone else mentioned it on the panel, but the most they can do is say no. And that's okay. We will have a lot of doors shut on us throughout our life, so get used to it, right? But no, so I would just tell you, try your best to find mentors, and it's okay if you don't find them right away, because I haven't, and it wasn't until like the last 2 years that I really found like my core network.
Can I just add to that point that Samar that she made? Mentorship is huge. Networking is huge. Those are big takeaways that I hope all of the attendees are hearing loud and clear. But there's a motto that I follow, and it has really, taken me very far. And that is that, like, yeah, you can ask. Well, first off, a closed mouth doesn't get fed. Let's just keep that in mind, right? And at the end of the day, you can ask for something, and someone can say no. That's inevitable. That will happen. There's no way you can avoid that outcome. But I will tell you this: if you tell yourself no first, then they'll never know that you actually had a need in the first place, right? So the worst thing you can do is just not make your needs, make them loud and clear, right? And you'd be surprised how many individuals, within this field are eager to help and eager to support and eager to mentor, or maybe they know someone else that's eager to support and mentor. So, utilize that opportunity at every avenue whenever you have the chance. Okay, coming back to the questions. Nicole, I thought I saw you raise your hand with the question. Nicole Isaacs, right?
Yeah, I raised my hand. Okay. Thank you again for taking the time to speaking to us today. My question was, and this might kind of sound dumb, but because I'm a pre-med student right now, currently in undergrad, I study chemistry, and it wasn't until recently that I started to begin having interest in entering the field of public health and wanting to integrate public health with medicine and I guess clinical practice in the future. And I was wondering, like, how does public health research differentiate from scientific or clinical research? As it's kind of a dumb question, but yeah.
Yeah, I can go ahead and take a stab at that. Actually, I wouldn't say I wouldn't say that I don't want to say that it differs per se. I will say that, like, there's overlap, between them, right? So the work I did when I was working in pharmaceuticals, there was overlap between public health and clinical research. Like we were applying an epidemiological lens to some of the work that we were doing, and it was on a global health scale, right? So these are the if you're familiar with the different pillars within public health, we were touching on several of those pillars, but we were still conducting clinical research. and to, you know, put this in more layman terms for everyone here who may not be familiar with clinical research or pharmaceuticals, right? We all, again, have been going through this pandemic. We all saw the vaccine that was developed recently, right? We were doing the exact same thing. We were developing a cure for multi-drug resistant tuberculosis, right? And the approach, you could say the principles and the approaches that we were taking to do this incorporated different components of public health, you know, and so I wouldn't say that they're separate. I would say that there's just that overlap that exists between them. And so hopefully that helps a little bit, Nicole.
It does. Thank you so much.
Great. I saw another question pop up in the chat. So for all panelists, what are some of your self-care practices that help you combat caregiver burnout or burnout in general? Because I think that applies to all of us, right? Especially for those working directly with individuals. So feel free to, you know, if any of you can chime in with your thoughts on that.
Maybe I'll start, but Sherelle, nice to see you here. Thank you so much for joining. For self-care, I would say, you know, the last 2 years, I've just been more mindful of taking care of myself, given all of the external forces going on right now. But I got into reading more. I've always said, oh, my New Year's resolution, read at least 12 new books. Never happened. So reading, I got into it a lot more. And I guess a little bit of a shameless plug is that we do have an alumni or a GPH book club. So that's something that has become a passion. And I'm thankful to Victoria for kicking that off with me and holding me accountable to reading the various books that we have a part of the book club. I'm into fitness, and that's something that I always try and make time for. And trying to do it in the morning is something that has been helpful to me as well. And talking to people. So whether that be therapy, I have a therapist, and you know, having that person there has been helpful for me. And then also like various career coaches too, that are some other resources that help me with self-care. And of course, I think my family does a good job with that too.
Victoria, I don't want to actually put you, you know, on the spot, but I think you do such a good job of like enforcing boundaries. And I think this is such a perfect question for you.
Calling me out. So this is something that I actually have a friend who is an artist who recently stepped away from the work that she did. She's a full-time artist. I have her to thank for all of my work on my own boundaries and boundary enforcement. But she used to be a therapist, and she also is an artist. And you know, she learned a lot of her boundary setting work through her work in therapy. And so one of the things that I have been doing a little bit more of in the last 2 years is creating boundaries, and not necessarily compartmentalizing in a negative way, but compartmentalizing in a way that makes you remember that you are not the work that you do. Like Corey was saying earlier, you are so much more than that. So I am a knitter. I knit all the time. As a lot of my friends know, I will not go anywhere without a knitting project with me. And that's because it's something that like, it helps to take me out of the moment because it's something different to focus on. I like movement. I'm not a person who meditates. For me, meditation makes me more anxious because it's sitting still. So having knitting around is something that helps me personally, but really like that's a physical thing that helps me to set a mental boundary. And so that's something that I've been doing. But I do think that when you set boundaries, sticking to them, reminding other people around you that you have a boundary, and even expressing from the get-go, saying, hey, this is a new relationship. I appreciate this new relationship, but I'm going to tell you right now that my boundary is that I may not respond to you right away, or maybe I don't respond to text messages after this time, or maybe, you know, if I put my phone down, or, you know, I step away from technology, I would like for that to be respected. And so that's one of the things that I've been doing a lot. And by expressing those boundaries from the front end, I've actually found it forms stronger relationships, because then people find that they can be vulnerable with you about their boundaries. and why those boundaries exist. So I think that that's something that we can all kind of start to lean on a little bit more, is finding that vulnerability through boundary sharing, because if we can't be vulnerable with ourselves and with our colleagues who are working in the same work that we're doing, by just sharing where that boundary is, maybe it's, I'm not going to talk with you about work, but I'd be happy to learn about you as a person, then we can't continue to grow the field because we can't take care of each other as a field. So I would say that that's what it is for me.
Thanks, Victoria. That was a really great response, and really great feedback from the panelists thus far. We have another question in the chat from Sophia. And so, how easy is it to change career paths within public health? And I have found that I cannot decide what area I'm most interested in. I could take a stab at that first, but I want to allow another panelist to speak before I do that. So, any volunteers on sharing your thoughts?
I can also hop back in. Oh, sorry.
Thanks, Victoria. I'll pass it back to you right after. I have a quick, I think I resonate with this question a lot because I came from working in very traditional clinical hospital setting with social determinants of health to working in, more traditional private organization that focuses on like the after effects of mass incarceration and those who are returning home from incarceration. And so I think what was really like helpful for me when I was in that sort of in-between period of, ready to take on a new challenge, but not really sure if I absolutely wanted to stay in the hospital setting or if I was open to other opportunities. What was helpful for me was to think about what were both the like technical aspects, like the hard skills, and also the soft skills that I enjoyed honing in on in my, at that time, my previous role, working in the hospital. What about that role and what about my day-to-day did I really enjoy doing? And also having the tough conversation of what did I not like about this role or about this space? And so for me, I knew pretty early on, I want to make sure that wherever I end up next relies heavily on analytics and using data. I knew that I wanted to go somewhere that focuses on community and national level impact. Those were the aspects of my previous organization that I was really drawn to, and I knew those are the skills I want to continue to develop and continue to get stronger in. And so for me, when I, moved into this new avenue of public health, it wasn't about, I want to make sure I'm still working in a hospital or I'm still working directly with patients. It was more so I want to make sure I'm able to use and also develop these other skills even further. And so my sort of recommendation or advice to anyone that's in a similar situation is, go old school, get your iPad or a pen and paper and write down, what do you enjoy about the role you're currently in, whether it's the technical, analytical side, or, you like presenting to executive team, you like creating, recommendations, you like that more consulting PowerPoint side of your role. Really list those out so that when you, go to LinkedIn or you connect with people who are in different industries, you can make sure that you're able to translate the parts of your role that you really enjoy into that new space too. I'll pass it back to Victoria.
I think you said it, focusing more on the hard skills or the soft skills. I just really resonated with this question because, like I said earlier, I'm just a magpie of lots of different work. So like Manpreet said, if you nurture those skills and maybe not necessarily you find that path isn't resonating with you, you can always switch paths. But if you have those skills, they will take you from one sect to another, from one area to another. And those skills really are what will carry you forward.
Yeah, and that was really well said, Manpreet. The beginning of my career, at the beginning of my path and career in public health, I focused a lot on health education and health behavior. I dove deep into that space, right? I can tell you all about it thoroughly, right? But then pivoted more into epi and global health, and then pivoted more into healthcare management and policy. And the point that Victoria just raised really was spot on, because now the work I'm doing at CVS literally covers all of them, literally all of them. I've had strategy projects that covered on social determinants of health, that focused on addressing providers within hospitals and health systems around primary care, focusing on, an epidemiological trial that's being conducted within a specific company right now. I never even saw that coming. I didn't even know, literally that you could do so many things at once within a space. But that's the point, is that like, if you're focusing on developing the skills, it actually allows any potential transitions or pivots, to happen more smoothly. So that's a really great piece of advice. And I think that's definitely something that I think I would encourage everyone here to remember. We have time for maybe one more question. I saw Nicole pose the question, but it looks like Corey, you've responded to that. So yeah, we have time for one more question and then we'll close out. So are there any more questions? Okay, I don't think we have any more questions. So we might end a little early. Well, again, I'll just use the few minutes we have left just to reiterate, we cannot thank you enough for being present, for this discussion. This has been really, really great, to be able to engage everyone here that's present and attending. And in addition to that, as we've said now a few times, please feel free to connect with us offline. If you want to connect with us on LinkedIn, please reach out and connect with each of us. If you have questions that you still want to ask, but you feel more comfortable asking those offline and not here, by all means, please reach out and we can address those questions and provide any clarity that you need. If you have more questions regarding the mentorship program, we're happy to provide more information on that as well too. There will be more information that will be shared regarding that in the coming weeks. So please keep a lookout for that. And if you are still looking and exploring your passion or your path within public health, we're happy to talk to you more about that if we can offer assistance there. But again, speaking for both the panelists and myself, just want to thank all of you. And I'll give the panelists a chance to, since we have a little few minutes left before we wrap up, if you guys want to have any closing remarks for our attendees, that's totally fine too, since we got a little extra time. So any thoughts?
Yeah, just reiterate what you said. Thank you so much for joining. I think knowing that our alumni board is in our second year, we're still fairly new. We would love the opportunity to connect with you all. So please do not hesitate to reach out, and know that we are here to bridge the gap between the alumni and the current student body. So it's actually our job. So don't feel bad if you have questions. It may feel dumb, but like we said earlier, no question is a dumb question. So keep sharing your voice and asking questions. It will really take you far in your career. But yeah, just to close, just lean in on our alumni board and help us bridge the gap between us and the current student body.
There any other closing remarks before we're officially done? Okay, don't feel pressured. You don't have to. All right, perfect. All right, well, with that being said, we are now done with the panel discussion. So again, thank you, everyone. We hope you have a great rest of your Monday, and we look forward to seeing you again at our next event. So have a great rest of your day. Thank you.